autoimmune disease runs in your family, you're right to wonder what you should be paying attention to and what you can do to stay ahead of potential problems. First, having a family history does increase your risk. 10 to 30% of people with some autoimmune diseases have at least one first-degree relative, in other words, a parent, a sibling, or children with autoimmunity. There are different forms of familial association. For example, someone else in your family could have the same autoimmune disease, or they could have a different autoimmune disease that has a similar underlying mechanism. In some cases, individuals will have more than one autoimmune disease, and in rare cases, there are families with multiple individuals who have multiple autoimmune diseases. One of the most significant genes that can affect disease risk is called HLA, which stands for human leukocyte antigen. HLA genes encode molecules that display peptides to T cells and influence immune cell recognition. Each of us inherits variants of HLA genes called alleles from our parents. One theory of autoimmune disease is that HLA risk alleles are more likely to display peptides that resemble self. Different HLA alleles are associated with different autoimmune conditions. However, having a specific HLA allele is not sufficient to develop autoimmunity. In fact, the vast majority of people with a so-called high-risk HLA allele will not have an autoimmune disease. Thus, typically, there's not one autoimmune gene that's responsible for causing disease, but rather a combination of multiple genes that, when inherited together, can increase the risk of disease. Even in identical twins, the fraction whom both have an autoimmune disease is about 30%, which is actually very high, but it's not 100%. Environmental factors can also contribute to the risk of disease development. For example, infections, smoking, chronic stress, poor sleep, obesity, and other medical conditions may increase inflammation or disrupt immune regulation, tipping the balance towards disease development. The good news is that there are practical steps that you can take to reduce your risk. Pay attention to your body, notice persistent changes, and bring your concerns to your doctor. Be sure to provide a detailed history of autoimmune conditions and symptoms that occur in your family. Taking these steps can lead to an earlier diagnosis. An earlier diagnosis, in turn, can allow you to receive treatments that reduce the risk of immune-mediated organ damage and result in a better quality of life. To learn more about autoimmune disease, manifestations, treatments, and research, follow Immunology Explained and the Autoimmune Association.